Have you ever wondered how the power of innovation can revolutionize healthcare in Africa? Picture this. Jason Carmichael, a public health graduate student, lands in Kenya in 2013. He sees a disjointed healthcare system, a shortage of hospitals, underutilized medical staff, and inadequate patient care. But instead of being disheartened, he sees opportunity. His encounter with Kenyan tech prodigy Peter Gicharu leads to the birth of TibuHealth in 2018, a social enterprise that aims to fill the gaps in the healthcare system. TibuHealth, with its innovative system, allows patients to request medical consultations, sample collections, and vaccinations through an app, a website, a customer support line, or an email. This clever shift in scheduling from the public sector to the private sector eases the strain on public institutions. And the cherry on top? Tibu's services are priced affordably, making them more accessible than the typical general practitioner's fees. But TibuHealth isn't a lone ranger in this endeavor. Across sub-Saharan Africa, countless social enterprises are tackling healthcare challenges through innovative and practical solutions. These social innovators have become pivotal players in healthcare, especially during the COVID-19 pandemic, augmenting government responses with their creativity and determination. These innovative actors employ community-centric approaches and inclusive solutions, bridging healthcare delivery gaps. They are risk-takers, armed with local insights and business acumen, turning their ideas into tangible realities. The World Economic Forum recently identified 10 common barriers to inclusive healthcare in Africa. These barriers range from weak healthcare capacity and infrastructure to limited access to quality healthcare and medicine, and from the economic repercussions of COVID-19 to inequality that the pandemic has exacerbated. Innovators are tackling these barriers head-on, yet they alone cannot create a more equitable healthcare system in Africa. Health inequality is a systemic issue that calls for a systemic response. The World Economic Forum highlights the need for a fundamental shift, a shift towards a broader health equity agenda. It means that social, political, and economic factors are integral to equitable health systems. Achieving this goal requires collaborative efforts across all sectors. In conclusion, African innovators like TibuHealth are rising to the challenge, addressing health barriers through innovative solutions. However, to establish a comprehensive health system that leaves no one behind, Africa must confront structural inequalities. It requires radical collaboration between public and private entities to support inclusive innovation. The journey may be long, but with the power of innovation and collaboration, a healthier Africa is within reach.